Hi, it's Dr. Noel Williams. Happy Mother's Day, May 10th, 2020. Hope all the mothers and everyone's having a great day today. So, COVID update statistics about 4 million people in the world have been infected with COVID, about 282,000 have died. In the United States, about 1.3 to 1.4 million have been infected, about just shy of 80,000, which was unfortunately what I was hoping would be our upper limits of death by the end of the summer or midsummer. So hitting it a little earlier than I had hoped, probably for a variety of reasons. Then in Oklahoma, 4,700, 272 deaths. So just that's, again, in Oklahoma, that steady slight incline, which is basically what's going on in most places, as I talked about last night or yesterday. Some of the Midwestern states are on the rise. The cases, or the places where there was the biggest influx of cases, are starting to come down. Only, I think it was 19,000 new cases yesterday and just shy of 800 deaths that were recorded. So those numbers are a little better, which is good news. We just have to see what's going to happen over the next 2 weeks to 3 weeks, as always, to project out and see what's happening. I think from a news point of view, a little bit of data showing, again, that the viral strains on the East Coast were markedly different potentially from the ones on the West Coast, which I've talked about before. There's a lot of variation in the genetics of the virus on the protein spike, and this other area that I had posted a few days ago in a written post showing a 3D picture of the virus. So definitely differences in virulence, which also means there's the ability to get reinfected, which then brings the challenge of making a vaccine to a RNA flu virus, which has never been accomplished. So again, the Israeli data on the antibodies, very exciting. That seems more likely to be accomplished. So again, we'll just have to wait and see about that over the next 2 weeks. Getting into the swing of the next several days to week, it's really important to see what happens in Korea and what happens in Germany. There was more reports today out of Germany that there's an uptick in cases from when they opened up their country. That's unfortunate because that means there's a lot more COVID-19 smoldering in the population, and once you get people starting to get together, there's spread, and that's what we're going to have to think about. There's been some questions to me about masks. Masks are very important, but let's apply some common sense to masks. If you're working out really hard and you have a mask like this over your face, it is going to be hard to breathe effectively. So that probably wouldn't be the time to wear a mask. Now, if you're working out somewhere, maybe wear a buff or wear a handkerchief. I think that would be fine. Again, you're just going to try to limit your droplet spread a little bit that you have, and maybe decrease your droplet absorption per se, or having stuff come in. But obviously, if you're working out hard, a mask is not going to work. You have to kind of go to a buff. And again, if you can work out outside when possible, in terms of your aerobic exercise, that would be great. And trying to be creative where you're not, where there are a lot of people. I know the Lifetime Gym on the north side's doing everything they can. They had an opening with Governor Stitt, I believe, last week, and I know they're pretty motivated to make it as safe as possible. It's just you have to remember, if the viral particles are being excreted by someone, they're going to kind of coat that area. So you just have to be, and if you're touching it and the person's sweating and blah, blah, blah. So just be really careful if you're in a gym. That would be smart. So we just are going to have to wait and see, and then go from there. But no, you should wear your mask. I was out today, went to the hardware store. I had my mask on, and probably about a third to half the people did, and about half the people did not. All the workers did, and all the workers had a little thing on their badge saying, "Stay 6 feet away, please," for COVID-19. Again, good decision making at the local hardware store by my house. But no, masks are important. and I'm going to illustrate the disjointed information about this. Like sometimes Fauci has said, don't wear masks, and the Surgeon General has said, don't wear masks because you don't want to take them away from healthcare workers. Why do you think healthcare workers wear masks when they're around potentially infected people? Because it decreases their infection rate. And so one of the things going on with the federal government, since there's still severely limited PPE, is they don't want anyone who's not a healthcare worker to be taking up PPE that could go to healthcare workers, which there's some, I think, rationale to that. But by the same token, at this point, since the virus is disseminated across our entire country, we also need to be able to protect ourselves. So if you have the ability to have an N95 or a KN95 mask or something, I would definitely wear it as much as you can. But to illustrate how disorganized and disjointed the CDC and NIH and everybody continues to be, if you haven't gotten it yet, and this is not a conspiracy theory, this is direct from Dr. Birx today, saying that they really have no idea about the statistics coming out of the CDC. And Robert Redfield, the head of the CDC, said, well, our computers aren't good enough to do the appropriate projections. And so, yeah, we don't know. So that's a wonderful place for us to be in, is that the head of the coronavirus task force and then the head of the CDC are basically, yeah, we don't know about our statistics. And Redfield said we needed to update it. He said he needed to have their computers updated. So let's think about that for a second. They're the Centers for Disease Control. They're the ones who make all the projections for diseases all the time. They're the ones who tell you and me, oh, do the flu vaccine, because we can tell what it's gonna do for you. And if you do this, this is what it's gonna do for you. And now they're saying, well, our computers aren't good enough to even tell what to do with this pandemic. Now, there's lots of other places whose computers have projected things, but our own government continues to lead the charge. And I'm being very specific. The CDC, NIH, and FDA have failed us. The director Kadlec, who's been in charge of some of this whole infectious disease stuff too, and preparedness, he decided last year, 2 years ago, or about a year and a half ago, when he became director of that we really needed to prepare for biologic warfare attacks much more than potential viral pandemics. So that's one of the reasons why the N95 mask supplies and some of those things went down, is they've really taken their eye off the ball. And these people have been there a long time. This isn't something that came up last week or last month or last year. This is a cultural problem at the CDC, that they blew the testing and they can't do the statistics. It's a cultural problem at the NIH that they won't do a double-blinded randomized controlled trial on Plaquenil. There was a New England Journal of Medicine article out this week showing that Plaquenil neither helped nor hindered in a study in hospitalized patients, and they called for a double-blinded randomized controlled trial. But again, the NIH is not particularly motivated to get that done because they have a culture that isn't about helping us. It's a culture, and the reason I bring this up is we have to change this as American citizens after we get through this whole event and help our government be responsible to us. And their culture is they're their own customer at the NIH. The culture at the CDC is they're their own customer, and the FDA is their own customer. And so when you become your own customer, you don't care about your true customer. And so when you look at the CDC having the Ebola event during Obama, the response was we sent a bunch of troops to Africa, which really mucked things up. But we didn't really do that well with Ebola. We just got lucky that it didn't get here. And it didn't change their culture to get them ready for a pandemic, as we can see. So anyway, I'm giving an editorial on that tonight, but it's just disturbing that the heads of the people at the CDC can't even do a computer model on what's going on. And the data is so bad in our country in terms of any statistics having to do with testing, then what do you do? And then politics plays a role, because some governors won't let the statistics out, like in our state. Governor Stitt has made it very difficult for statistics to come out. And then in Florida, they've taken that away from the medical examiners. So it just makes it hard to have good numbers. And so it makes it hard to develop plans. So on the positive side, we want to be taking our vitamins, washing our hands, and wearing our masks. That would be my advice for everyone. Watch the exits and entryways of wherever you go. Avoid public bathrooms as best you can, and avoid handrails. Don't touch stuff, which is hard, but you really don't want to touch things because there could be viral particles. And it applies too for other viruses, just the cold virus too. You're going to lower your risk. You're not going to hurt your immune system. So that's the summary today. Not a lot of big news other than trying to see what happens in Korea and Germany, and our governmental agencies are still 3-4 months in, clueless. So anyway, take care. Good night.